Hey, good evening. Thank you for joining us, everyone, on the Political Deep Dive. I'm Dave Valente, joined this evening by Dan, the Man Fishman. How you doing, Dan?
I am doing so well. I
Good.
want to
Way to
talk
go, Dan.
about. Can you hear me?
Yeah, I can hear you. You're frozen though.
I'm frozen.
Let it
Friggin'
go.
OBS. All right, hang on. Why don't you bring AJ in? She's more interesting than me anyway.
Yes, tonight our topic of discussion is healthcare, and wow, you're ghost Dan tonight.
All
Ghost
right.
guns and ghost Dan.
I was
Our
doing the
top-
Scooby Doo. Now I'm in.
All right. Our topic is U.S. healthcare, and who better to talk about U.S. healthcare than our co-host AJ Campbell? Hello, nurse.
And we
Hi.
hello, nurse.
How are y'all tonight?
Doing
I
great.
am doing well. How about you? What is shaking?
I'm
So,
doing very well.
is this? Do you wear this outfit at work?
No,
Okay.
I have worn this outfit at work when it was Halloween. This is actually the hat that I wore for my pinning ceremony when I finished nursing school. And
Awesome.
I have knocked it off my head about 75 times just tonight. So yeah, I don't see how this would work practically ever.
I'm thinking, yeah, because I was looking at it, I'm like, that's several hairpins.
It's a couple, yeah, I'm not gonna lie. When I was growing up, my mom went to nursing school when I was like first, second grade, something like that. And I'm gonna be 40 this year, so y'all figure out the math. She would actually leave the house in the white dress and the tights and the thick shoes and the hat. So
Yeah,
it wasn't
my,
that long ago.
my mother-in-law was a nurse in Georgia. She was retired by the time I met her, but there are pictures of her in the old nurse's uniform,
Oh yes.
and yeah, it's an interesting uniform now. Like, I mean, I get that it's tradition, but I don't think I've ever seen a working nurse in that uniform ever.
The
Well, it
only
also,
ones that I've seen lately were we had a Mennonite girl in our class, and her scrub, she wore like the regular scrub top,
Mhm.
and like scrub skirt that they made themselves. So,
yeah, I mean, there's also, like, I mean, nursing has changed too in
Oh, yeah.
terms of what it means. Like, now nurses are, so I worked at a place called the MGH Institute of Health Professions where we trained DNPs, nurse practitioners, stuff like that. And there's one of the most important things that they taught there was that doctors study medicine and nurses study patient care. And if you want to know who's going to do a better job of listening and hearing what the patient is telling them, it's always a nurse because the nurse has that relationship and they train on that. And that's such a difference from what nursing was like 50 years ago, where nurses were, sort of the what's a good way to put it? They were the mechanics of the hospital, right? They made sure everything worked from point A to point B, stuff like that. But now they're so integral to patient care that it really is a different job.
do have to give mad credit to like CNAs though, because they are literally the backbone of healthcare. They are the ones that are picking up these patients that can no longer move themselves. I don't know if I would have survived a couple of jobs that I had without amazing CNAs. And they're the ones that know which socks are your favorites. And this can be important with patients, like dementia patients, especially, it has to be exactly what they want. The CNAs are the ones that know those tiny little details. Sorry, quick shout out to those folks.
Yeah, absolutely. And it seems so much now that healthcare is your healthcare when you go to see a doctor now is really actually you're going to see a nurse. A nurse is the one that's treating you. Nurses can now do prescription drugs and all that stuff. And it's amazing how healthcare, especially even the last 5 years, has just morphed into the responsibilities of healthcare going much more down into the nursing level.
I think it's the increase in patients. We have sicker patients earlier in life. You have people in their 30s and 40s that are having these
Mhm.
chronic illnesses that used to be more of a 50s and 60-year-old thing. Some of that is just the way that we live, the way that we eat, what we put in our bodies, how we treat ourselves, all of that. But you also are discovering things earlier. Like people are figuring out that they have a tendency to have, if it runs in your family, you're going and you're getting the screenings and whatnot. So that increases the patient load as well.
Yeah, yeah, absolutely. So let's talk about healthcare in the United States. We'll start with the positive. Let's start with the positive. What is the U.S. healthcare system doing right now?
I think. Go ahead, AJ.
My best would be the minute clinics, honestly, to handle the colds and kids that run a fever at school and have to be checked out before they can go back. I think that's something that's incredible. It doesn't really have anything to do with necessarily U.S. healthcare. I think it has to do with a bunch of moms decided they needed something that was after work so they could take their kids to get checked out. But those I think are going very well. Now, Dan's going to have a great answer.
Well, I think at the top end, if you're a billionaire, there's nowhere else you want to be to get your health care. We all know somebody right now who's at MD Anderson in Houston getting the best possible cancer care. There's a thing called proton therapy. Proton therapy is essentially chemotherapy, but it can be focused into a 1 millimeter cube area, and they can make it up and down through your body, so you can get really intense radiation right on the cancer, nowhere else, and it doesn't make you sick. Now it's more commonplace than it used to be. But when I was working at MGH, there were only 37 proton therapy machines in the world, and 28 of them were in the United States. I'm willing to bet wherever you are, and I know you guys live in rural areas. And when I say rural areas, I mean not the Northeast Corridor or Seattle or the Southern California. You don't live anywhere near a proton therapy machine. At the high end, there is no healthcare system like the American healthcare system. It's why people come here. Recently, a Canadian minister of health for Labrador, came to Miami to get his heart surgery done. And they asked him why. And he's like, I can go to a place in Miami that, uses the most modern techniques. Because now when you have a stent put in, right, they go in through your arm. Okay. It used to be that they would go in through your groin because it's easy to get in. And then before that, they cracked your chest open to do it. Okay. But now microsurgical techniques, stuff like that. Consider the fact that most hysterectomies in the United States right now are done by robots. Okay. Doctors don't do that surgery anymore because doctors aren't as good as a machine at telling live flesh, live tissue from dead tissue. At the very high end, there's nobody else like us. But
Yeah,
you got to pay a lot of money for that.
it is, and it doesn't make sense when you start thinking about other places where you can go to get healthcare, such as let's take a look at dentistry. Like dentistry in the United States with dental insurance is a joke. It's much cheaper to actually go down to Mexico and get dental treatment. And a lot of times when you go to Mexico, it's American doctors dentists performing the procedures. They're getting out from underneath the American system to be able to provide healthcare at a much cheaper rate. In the United States right now, to get um, the implants, top and bottom, it's about $90,000, and to do it in Mexico, it's like 30. That's a significant savings, and that's like flying to Mexico, staying in a resort style complex, doing the surgical procedure, staying there for a couple weeks, and then going up for the follow up, and then going back home. That's that's all that's included in like the Mexican version. The American version, $90,000 gets you into the clinic, gets the implants, and you go home and rest. So there's a significant difference that, healthcare in, I know a lot of trans surgeries are done in not only Mexico, but in Thailand and some of the Southeast Asia countries, because again, it's significantly cheaper.
Kyle Varner, who's an MD in Seattle, has talked about the fact that he travels for a lot of stuff. He goes to Mexico now. He does have the capacity to, do better research than the average person because he's a practicing MD in the United States. But it is clear that, value for dollar, American healthcare system isn't competitive. It's just a question of what you want and what it's going to be. I'll relate my experience. This was 11 years ago. And I mistook GERD for a heart attack. I'm not the first.
Very common.
I'm not the first person in my weight class to do that. And however, I worked at Mass General, MGH. We refer to it as man's greatest hospital. So they took me in. I will say, admittance took longer than I thought that it should have. It took like 15 minutes. But for most people, they'll tell you it's worse in other places. Got into my room. Rooms at Mass General, there's no paper allowed because paper is considered too infectious to have in a room with a patient. So it's all touch screens. And then there are people who come through and they clean the touch screens every 4 hours. Every surface gets disinfected every 4 hours in every room. When my meds came, the meds are in a box that cannot be opened by a human being. There's a machine. I have my wrist bar that gets scanned. The bar with the meds in it gets scanned. If the computer says this is a match, then the box opens and I can get my meds. I'm like, that is so cool. And the orderly said, well, that's not cool. Those meds were put there by a machine. Human beings aren't allowed to touch drugs in the hospital because human beings make too many mistakes, either the size or the scale or the weight or something like that. All the medication, with the exception of, some very rare meds or something that has to be injected into you, are built out by a computer. But this is at the high end of medicine again, right? We're talking about, I had a Cadillac plan. And, I'm staying in certainly one of the 4 or 5 best hospitals in the world. That stuff, on the take counter of it, my dad had a heart attack in Texas. And he was in really good shape at the time. He was out running and something felt wrong. And, when you're 75 years old and you're running, you're aware of everything that you're doing. And so they took him in. And my sister, who worked at, I don't want to say the name of that hospital for legal reasons, but a very well-known hospital in Houston, in the Rice area. She came down there to see him. And when she walked into the area where he was, there was blood on the floor. She's like, that is not okay. How has that not been cleaned up? From, things happen, stuff like that. And so, the quality of care varies incredibly widely on where you are. And I think that what we're seeing, to AJ's point, is that a lot of times, a lot of things can be done in smaller areas where people are more responsive rather than the big monolithic hospitals. And in fact, what's crazy to me about it is we talked about our friend, Dr. Kyle Varner, who I should directly message so that he could come and talk about this. Dr. Varner is a hospitalist. That is his specialization. Okay, he specializes in how a hospital treats people, which is different than actual medicine, right? It's a specialization of this very powerful tool that we have. But a lot of times, there's a lot of stuff that happens long before somebody gets to a hospital that we could be doing that would save a tremendous amount of money. And we're not doing any of that either. All right, I want to be quiet for a little while.
All right. Well, so, I think another area that we could identify as a problem within the U.S. healthcare system is definitely pharmaceuticals. Pharmaceuticals here in the United States are ridiculous, and they're ridiculous because one, we're it's open market. There's no control, very little controls over it.
It's not an open market.
But no, it's that we don't allow open competition outside the United States.
Right.
And if we did, that would lower the cost. Also, we don't even allow. So we're allowing the Medicare and Medicaid to be able to negotiate drug prices, but did not allow that on the open market and cap cap the market that they did in this latest Inflation Recovery Act bill that they just passed, which means we're going to be paying for the cap on Medicare and Medicaid as non-Medicare Medicaid consumers.
I do have a nurse hack for that. I don't know if it's necessarily a hack. It's something that you as a patient should ask for. There are a lot of times that patients do not know that these things are available. And they are. For one thing, medications that are name brand, you have some options. Before they go generic, we all have to pay the name brand prices, but you can go to the manufacturer's websites. You can get coupons, especially for medications that are one-time doses. Like if you're getting a colonoscopy, you're getting your screening, you're being responsible. They prescribe Sutab, which is like, I don't know, I think it was like $180. But I went to the website and got the coupon and it was $40. That's huge. I mean, and it's a one-time medication. I mean, there's nobody that's taking Sutab for fun. I promise you that. It's specifically for colonoscopy. So, respiratory medications are the same way. I have been an asthmatic my entire life. It wasn't until I was an adult that I realized how much my mom, she worked second jobs a lot. And now I realize it was for my respiratory medications, because
Wow.
it costs a lot to breathe.
Diabetic
Really
medication.
important.
Diabetic medication,
Yep.
and asthmatics, COPD patients, they have us because we have to have these medications. So you have to pay the prices. You can ask for samples from your doctor if they prescribe you a new medication. Most doctors' offices have reps that come in. They bring salads for all the nurses and suck up to us and bring samples of the medications. I know because I did this. I had a Viagra rep actually that would bring me bananas and dark chocolate.
Nice.
That is how he would get into the office. Is he would bring chocolate. Smart guy. But that also meant that I had Viagra samples for patients to use, because this is also a somewhat expensive medication. And if it doesn't work, you don't want to buy a whole bunch of it, because then you have a whole bunch of pills that you can't use. So what's the point? The other thing is, when you go to the pharmacies, ask the pharmacist specifically if this is only available in a name brand medication. A lot of things, there are generics. Sometimes doctors don't know that. They will have to talk to your doctor and get permission or whatever, but it could save you a ton of cash. So that's all I've got on medications.
Good stuff. So I want to first say, Viagra is a great example because, as Dave knows, right now, if you want to buy generic Viagra, it's super cheap, right? It's $2 a pill now, because it's no longer covered by the patent, so it's generic.
Yes.
Patent expired one day. One
Yeah.
day, and that was what allowed all these generic manufacturers to pop up.
Right. And of course, the thing about it is that what if you were saying, and so as an example, my mom at the end was taking Humira, which you've probably seen ads for on television. Okay, that's $8,000 a month. That's a lot of money to spend to save your life. Now, the question is, why? Why do we charge people that much money when somebody else can actually make that same drug in a lab? And other people have asked that question. India does not honor medical patents. They just don't. Their argument is medical patents are murder. And so any drug that you want, if you're willing to shop for it online, you can buy it from India. And I can tell you that I have certainly ordered lots of medication from India. India is a modern country. Okay. Lots of scientists, lots of good labs, stuff like that. Do your research. But, what I'm telling you might be technically illegal, but you're not going to get caught. You can buy drugs from Indian pharmacies and have them shipped to the United States, and they'll get here. And so if you wanted to have, just as a backup, just in case, Cipro. Well, let me talk about that too. If you want to buy antibiotics, of course, you can buy antibiotics from vets. Animal antibiotics are certainly higher quality, made in the United States, are certainly higher quality than you would get in many other countries around the world. I have been very happy with, amoxicillin. I've never used Cipro. I am guarded in how I use modern antibiotics because I do believe that if you don't complete your course of treatment, etc., you're setting yourself up for a lot of worse things. However, I do want to have a large supply of antibiotics around just in case, zombie apocalypse or whatever. Because antibiotics is something that is really hard to make. I mean, I know the basics. I could make sulfa if I had to, but I don't think that that's where most people are going to be in the zombie apocalypse. And so having those things on hand, and let's talk about some of the other stuff that's out there. PrEP, right? PrEP saves lives. For people who don't know it, PrEP is a prophylactic that prevents HIV from taking hold in your body. And I have mixed feelings about that because I think that I was starting to hear rumors that the widespread availability of PrEP is leading to riskier behavior, and people forget that there are other STTs out there that are just as bad. But PrEP is one of those things that because it's hard to get, at least it's a little bit hard to get in the beginning, people aren't doing what they need to be doing because you have to go through this whole rigmarole of having to get a prescription, stuff like that. You should be using PrEP, and I'm not an expert on this, so please check yourself, but just assume you should be using PrEP for 28 days before you're engaging in risky intercourse or risky behavior that you're hoping PrEP will help you with. But PrEP's remarkably effective in intercourse, and it's pretty effective even for intravenous drug users to prevent the spread of HIV. But all of these things, right? If we think that these drugs are a great thing, why do you have to go through a doctor to get them? That's where we're broken. And the thing about it is, we're better about it in the United States than other places because I can complain about American healthcare, but at least here, chances are pretty good if you ask a doctor for something, you've got a good reason, they'll probably give it to you, or it's pretty easily available on the gray market. For example, we could talk about OTC too. Off-label, sorry, not OTC, off-label uses of medications. Probably the most famous of all, right, is Viagra again, right? Viagra was not actually meant to be a, what's a polite way to put it? It wasn't meant for
medication.
Exactly.
It's called erectile dysfunction.
Exactly.
That's a thing.
Well, right, exactly. But it started off, it was supposed to be a heart medication. And what happened was when they were testing it, Pfizer found that, when the tests were over, the pills weren't coming back. People weren't returning them. And then they got anecdotal evidence. And then they're like, we are sitting on a gold mine. Pharmaceuticals.
Can I address one thing that you said?
Please.
Okay, antibiotics. I'm not a huge believer in people prescribing them to themselves because with antibiotics, if there's a culture run and you see what bacteria we're actually dealing with, this antibiotic would be the best. Now, I have this isn't a nurse thing. This is a me. I grew up in Tennessee and I grew up in Warren County, which is the nursery capital of the world. So I had constant allergies. This was the 80s. Apparently, that they just didn't think to test me for allergies and throw some Zyrtec at me because that wasn't a thing yet. So I kept getting treated with antibiotics, and now I have allergies to a lot of antibiotics. I have life-threatening reactions to them because I feel like they were overprescribed. Or I mean, maybe the doctor was keeping me alive for the day that Zyrtec existed. I don't know, but either way, overuse of antibiotics is a terrible thing. I do agree with the finishing the course of the antibiotics because I hate when people are like, "Oh, well, I took my leftover amoxicillin from like my sinus infection." Oh, neat. Why did you have it left over? And how long ago was that? You know, keeping them and stockpiling them, do keep in mind expiration dates. That's all.
No, I mean, that's a very big thing with, because we've seen bugs become resistant to certain varieties of antibiotics that had worked with those bugs in the past. So you're right. There has been significant overprescription of um, antibiotics, and I think that we're kind of seeing a almost a pullback where doctors are more reticent to prescribe antibiotics unless they're absolutely necessary. Um, maybe even
They
beyond
seem to have a
necessary.
bit of a checklist, and I don't necessarily agree with that either. I'm always about send it to the lab. If there's a question, send it to the lab.
Yeah.
That's why we have them. You know, why not culture it? If there's a cough, culture the sputum. If there's, burning when you pee, send it to the lab. Like, there's your answer right there. Um, I, I know that people are willing to try whatever's going to give them relief right then, but wouldn't it be better to start one antibiotic when you know it's the right one rather than start one and then they send off the culture and, oh, that's not right. And you've taken 3 days for nothing. It seems like bad practice to me.
Yeah, that happened to me where it was, we're going to start you on this, and once the culture comes back, if we need to change, we'll change at that point. And it does seem kind of pointless, unless they actually get the diagnosis right. But yeah, definitely that's something that you know we just came out of a pandemic, and I think that's scares a lot of people that if the next pandemic hits, creates a super bug that the antibiotics and all the vaccines may not be working against. It's a concern.
Yeah, I mean,
I like the
the
concern.
science is undeniable. You
Hmm.
can prove that. First of all, I love the fact you can prove evolution. So all those idiots who think that evolution doesn't exist, you can prove evolution in a petri dish, um, right? Antibiotic resistant staph is probably the nightmare bane of every hospital. However, uh, think about the countries where you can buy antibiotics over the counter, right? Mexico, for example. We talked about sulfa earlier. You can buy sulfa and penicillin over the counter in Mexico.
Yeah.
And if there was ever a country that was going to produce a superbug, Mexico could go to the Olympics in that category. There's a real threat to all of those things, but the answer to that is education more than anything else. The sad truth of it is you need to be the boss of your own healthcare. Pretty much what we're talking about, all this stuff. And this is the point that I was going to come back to. And then I said I wanted to shut up for a little while. All right, I'm done shutting up. Now, I saw the best panel I've ever seen with Mary Ruert and Kyle Varner. Mary Ruert is a PhD, and Kyle Varner is an MD. Mary was a representative for, I want to say Novartis, but one of the major pharmaceutical companies. And one of the things they talked about is the fact that in reality, government is in conspiracy with the pharmaceutical companies, because if everybody just doubled their daily dosage of vitamin D, healthcare would go way the heck down. We'd be saving so much money, but they don't do that, right? All this stuff about, we're going to tell you what you can eat and how many calories are and everything like that. And they said, you know what? Everybody should be taking a vitamin D supplement and it'll improve your health enormously. Everybody should really try to get out in the sun for 15 minutes at least every day. And that can't be just like just your face exposed. Those sort of things, we'd be a much healthier country. And I got to talk a little bit here. My sister was a clinical dietitian for many years. Now she's in hospital administration. But one of the things she talked about is that in general, doctors don't talk, healthcare industry doesn't talk at all about the health impact of your diet and your exercise. Now, people will talk a little bit about it, but doctors are often fearful that if they tell somebody, oh, you really need to lose weight, that person's going to be mad or angry or anything like that. When in reality, that's just a simple thing. You could do more of that, and you could have a way to make it so that it is not a personal thing. They could just, going to the hospital and they say, your size, your weight, we know that your health could be increased if you did this. One of the things my sister suggested was she's like, you know what? Obamacare, and my family is all academic liberals. This is where they are. She's like, but Obamacare pays for a doctor's visit every year. Okay, a preventative and prophylactic doctor's visits are a really good idea. You should meet with a medical professional to talk about your body, the same way that you would talk to an IT professional about your computer, or a mechanic about your car. She said, but people should be meeting with a nutritionist once a year too. Talk about the fact that if you just improve your diet, even if you're not thin, if you're eating well, you can be a lot healthier than you are now just by meeting your basic vitamin requirements. People aren't doing that, and there's no education around that, anything else. All the stuff where we want to fix people's healthcare, right? It's a lot easier than actually focusing on healthcare, focusing on basic lifestyle. And by lifestyle, I mean the food that goes into your body. And I say that as, a person who right now, I've had a really good first 10 days of losing weight. Thanks. My shout out to Tyler Harris. Thanks for you guys for noticing. I'm just kidding. But there's a lot there that we can do. And a lot of what's wrong with American healthcare is that it is created to treat American health problems. And a lot of our health problems are of our own creation.
I completely agree with that.
All right.
I do. I worked in a urology office, so we had to get very personal with people, because whatever they came in for, whether it was erectile dysfunction or a kidney stone or incontinence or cystitis, whatever, you get very personal, and you have to talk. You have to have those conversations. I worked for a female urologist, which is not super common, and she was my age, so it was young women in an office. And we would have to have those conversations. Ma'am, you do have some extra weight, and part of this is going to be related. Everything's related. If you're carrying more than you should, you're putting stress somewhere. Just if you are overweight at all, and I am, you are
Me too.
putting stress somewhere. I did notice when I had weight loss that my back wasn't hurting as bad, and my chiropractor noticed that I wasn't as stiff once I had lost more weight and could move easier. Results, yeah, it's slow, but once you see just the slightest result, man, it's amazing. You
Yep.
put on a pair of jeans that don't fit, and they're not pinching your thighs. That's neat.
Well,
Yeah.
The rewards are there.
for me on the wrong side of 50, the change from just adding a little bit of yoga to my day in the beginning, just some stretching and stuff like that, to, not get up out of a chair and, stretch like that. It's awesome. Right. I mean, it is amazing the very simple things you can do that dramatically increase your health. But, if we're going to go back and talk about healthcare and what the alternatives are, Dave, I'll ask you, what do you think are the alternatives that are great that don't involve, a government health czar?
Paying greater attention to preventative health, going and doing your annual physical exams. When there is, if you notice something, you should go in and talk about it. over the last year, I've had issues where I thought, maybe I've got something wrong with my kidneys or my bladder. Just this is going to get a little bit personal, but this week I actually went in for a procedure where they used a camera that was attached to a catheter and went up in me, and it was
That's
an
not good.
interesting experience. It's called a cystoc.
I was very gentle though.
Oh, yeah,
Cystoscopy. Yes.
yeah, whatever.
Yeah, that word.
That word. Uh, I won't recommend it on a daily basis. I mean, but you know what? To give me a little bit of peace of mind about, because cancer runs in my family. So, if I'm feeling something weird in my bladder area, being able to go in there and watching your bladder work was fascinating. Like
Yes.
watching the openings to your kidneys open up and
Ureters.
just drop a little urine into the bladder. That was really fascinating, but it also going in and out from the prostate and all that stuff. It was absolutely fascinating and really kind of provides you a sense of comfort in that, okay, I've been able to see into this, and I know that what I'm dealing with is not that. There's still other things that I'm going to look at, that some medications that I'm taking, all that stuff. But it's when you one get your preventative medication taken care of. So, ladies, get your breast exams and get your Pap smears. Get those done on an annual basis. Guys, do your self exams. Go in for your annual physicals. Don't be afraid of the prostate exam. It's just a finger. Um, you know, eh,
That's how it starts.
well, this is true.
But so
But
it's
you can
interesting.
pay more for the extra treatment.
But let's talk about that a little bit too, because my understanding now, and people can correct me if I'm wrong, is that their family history plays a lot of role in, and genetic tests as well, in terms of how often you should be doing mammograms and prostate screening.
Sure.
The yearly mammogram was the gold standard for a long time. But there's a lot of talk right now that if you're in a family that's never had breast cancer ever, you know what? You might not need that much radiation. Definitely consult with your doctor, talk about it. But that's something that, on the cutting edge of medicine right now, people are saying, yeah, we might have gone too far that way. On the other hand, if you have the BRCA gene, you're crazy. I mean, yeah, there are a lot of people who are very wisely getting preemptive breast removals because their family history says, yeah, it's going to kill you otherwise.
Yeah.
So talk to your doctor. And the thing is, your personal physician, your personal care practitioner, and I like that word better, because I will always choose a nurse practitioner over an MD to be in charge of my healthcare, because exactly what I was talking about beforehand. Nurses listen. Nurses are interested in patient care. I have had some excellent doctors. If you hear me now, there are days when my health is not great, and you can hear me cough a lot more than the normal person. I have some pulmonary stuff, smoking related illness. Kids don't smoke, but I stopped getting sicker because I had a great pulmonary doctor at Mass General, who said to me, he's like, Dan, you've been, because I had been to 3 or 4 other doctors, had unnecessary surgery, stuff like that. And he's like, here's the thing, Dan, I can be a great doctor for you, but you'll have to be a great patient. I need you to start keeping logs of what's happening, what affects these things, stuff like that. So, for example, one of the things about it is that my COPD is definitely related somewhat to overeating. GERD is a common factor in COPD, and learning that, it's slowed down a little bit by eating. Hopefully it's, eventually going to get better. This is the best, like I said, I'm in the best place I've been in a long time for that. But that level of healthcare, it has to be personal. And in many ways, that's why I think that a lot of what we complain about in the healthcare industry is actually some of what's the best. If you look at the model of American insurance companies, okay, you know, American insurance companies did some really shitty things. I'm trying to remember who was the libertarian whose mom had breast cancer, and the insurance company essentially denied her treatment, thinking that she was going to die before she would be able to sue them if they didn't pay for her really expensive treatment. That sort of stuff happens. There's no question about it. And insurance companies can be terrible about that. On the other hand, you see insurance companies, because they don't want to spend a lot of money, doing things that are really good. My insurance company pays for a gym membership. I can get a free black card at some gym. I don't actually know what that means, but there's some gym where you get a black card and you go into any gym. They've got like 2,400 around the country and do whatever people do in gyms. And they,
Whatever,
huh?
whatever they do in gyms.
Whatever people do in gyms. I've seen some weird pictures. But that's that sort of preventative medicine is, you know, amazing. The insurance companies are doing it because they have a financial incentive for you to not get sick. They're going to do everything they can to try to advise you to stay as healthy as possible, because that's cheap for them. So here you are. These people have a financial incentive for your well-being. And that's a great idea. And that's the great idea of insurance in general. Why insurance, private insurance, is such a libertarian concept. You know, we have this idea that people have a financial motive to pool together to protect themselves against risk. But then to do that, to protect themselves, they need to have everybody in the pool doing everything that they can to protect themselves against risk. One of the worst things that came out of the ACA was, you know, even though President Obama promised, if you like your healthcare plan, you can keep your healthcare plan. But that didn't happen because there were a lot of high-end healthcare plans for very healthy people. People who, you know, they had to pass a physical every year, but if your blood pressure was under whatever, if thank you, James, Planet Fitness. If your blood pressure was under a certain thing, if your heart rate was at a certain level, all that stuff, if you had a clean chest x-ray and you had to do all that every year, your health insurance was very low because you were in a low risk category. And that was great. And they said, these are the things, but you knew that in order to keep your health insurance low, you had to maintain that great blood pressure. You had to maintain that great heart rate, and you couldn't smoke. So those
was a big one. I used to be charged $30 extra when I smoked. My insurance was $30 extra.
And you think about it, that's the way it's a good thing about it. People save money on that. But now all that's illegal because nobody can be denied for pre-existing conditions. And you can't be charged different rates for, and smoking is a pre-existing condition. So all that stuff, all the things that could have been better if we'd let them go better, have all gone by the wayside, unfortunately.
Yeah. So I'm not expecting a whole lot of government either way. Like to the point right now, I don't think Congress can act either way, whether to remove regulations on the system, to end ACA or whatever. And I don't think that there's enough momentum at this point for a single payer. But if Congress does get its, I hate to say it this way, its act together, it seems like more of the momentum will be towards a single payer. Why is that such a bad idea?
Say it again. I'm sorry, I didn't follow it.
Why would single payer healthcare be such a bad idea? You have all these other countries telling us that we're, you know, reprobates for not being able to do single payer healthcare.
I mean, single payer healthcare is an interesting idea, except that in order to do it, you have to tell everybody else that they can't have private insurance. Now, when I went to school in England, I had to sign up for, excuse me, for NHS, but this was mid 80s. So I also got private health insurance while I was there. And a lot of people do that in single payer systems. So single payer system pays for your your generic stuff. And then, the top of the line stuff like Canada, for example, would be a great example of that, right? When the Minister of Health, who their single payer system, came to the United States for his bypass, he had the option to do it because he was independently wealthy. So the problem with single payer healthcare system is that it's a race to the middle, and it takes away the high end of healthcare. Now, that's good for the people who are at the bottom, but it's bad for the people at the top. What is the legitimate argument for taking away the best from the people on the top? And you're going to say it's for the, for the good of the state, for the good of the body politic. I hear that, but I just don't think that I would say that it's okay to use force to do that.
Well, I mean, look at it this way: the stuff that we do for the rich people at the top eventually makes its way down because it's innovation.
Right.
They're able to buy into that innovation, the latest techniques and things like that. And the more that it's used, the cheaper supposedly it's supposed to become. Now, healthcare has not really gotten cheaper over the years, but if you cut off at the top, then you're really cutting yourself off for future innovation, I think.
I don't know that getting government involved in anything ever is a good idea. I personally think that patients need to take it upon themselves to take care of what they are having to spend, what they are having to do. And the easiest way to do that is shop around. It's not convenient, it's not fun. If you follow me on Facebook, you've seen my fun times with pharmacies this past year. But you can do that with imaging. I mean, you can do that with procedures. You can have it at a surgery center cheaper than at the hospital. I mean, these are choices you can make in a non-emergency situation. I'm not saying you go in with right lower quadrant pain. They're like, we have to get out your appendix. And you're like, hold on, let me shop around. No, I'm not saying that. I'm saying if every year you get a low dose lung screening for smokers after age 50, certain pack year history, you qualify for an annual low dose screening. And every year you get it at the hospital. Well, one year you decide to call this imaging center down the street and it saves you like $600. I mean, that is something you can do. If you get, maintenance screening for lung nodules, liver nodules, there's so many that you can that have this yearly screening. Shop around and see. And that's where our power is going to be. That's how we're going to take back healthcare. That is the only way it's going to work is if we go to the places that, first of all, are giving the good healthcare and also doing it at a price that makes sense. A lot of these imaging centers, they have all the modalities you're going to need. They have the contrast. They have the ability to do it. And a lot of times they have the open MRIs. So people that are claustrophobic are able to do that because the imaging centers, they know that's going to pay them back. They're going to get that money back the first year they have that open MRI because there are so many diseases and so many, like contractures and stuff. There are reasons you can't go into an MRI. Hell, obesity. You can't go into an MRI. You have to have the open one. They have that already.
More than that, 10% of the people who go into a closed MRI come out claustrophobic. And that happened to me. So I had to get a cardiac MRI, which means you have to lay still for a long time. So it's going to be like 30 minutes like this. And then the technicians didn't understand one of the doctor's requests. So they left me in there while they called the doctor. So eventually I was in there for an hour and I squeezed the thing. I'm like, I'm freaking out. I need to get out. So they let me out. Of course, first they're like, well, what's going on, Dan? Are you okay? You sure you can't do it? Nothing? I'm like, no, I need to go now. So they took me out. But then for like 2 years afterwards, I had real claustrophobia. Like I had trouble flying. I had trouble on a bus. And I'm back to normal now, but I would never get another closed MRI again. Like, because they wanted me to come back. And this is for a cardiac issue, right? It was something that was serious. I'm like, nope, not doing it. I would rather die than do that again. So now you have these great places out there. And it's a great example of that. those places don't exist in single payer healthcare,
Mhm.
because why would they?
Another thing that's impacting
Okay.
US healthcare is a thing called certificate of need, and it really limits your choice of
Right.
healthcare providers. Like in West Virginia, so if I wanted to get an MRI, it'd be better for me to go to Maryland or Virginia to do it because they have those MRI machines. They have there are a whole lot more
Field
in those
MRI.
states.
I will just plug them right now. Maybe they'll become a sponsor of the show.
Yeah, and and but in West Virginia, it takes months and months and months to to get an appointment. And I think that's one of the things that I think is driving people to look at nationalized healthcare, single payer healthcare. Is one of the arguments that a lot of people use against single payer healthcare is that, and the reason, one of the reasons why, because I've seen that health minister, that there have been various Canadian ministers that come over to the United States for healthcare, and one of the reasons is, especially for like a heart issue, the waiting list is long. So you're going to wait a few months to get a heart procedure when you think that you need a heart procedure probably in the next month. And I think since the pandemic, we've seen hospital wait times getting procedures. I know I'm seeing it here in West Virginia. Getting procedures done in a timely manner is getting pushed further and further out, and it's reducing that one argument that we really have for a more free market healthcare system, even though we're not. Um, versus single payer is the time suck that single payer tends to have because you don't have as many people in the healthcare system because it's not as lucrative a field in England or rest of Europe or Canada versus the United States.
Yeah.
Well, we're already having the shortages. We're having the shortages of nurses. We're having the shortages of doctors. I mean, they are leaving in droves because the companies that they work for handled it badly. They handled a healthcare crisis badly, y'all, and they still are. I mean, they're. I'm happy with my job, and most of us are happy with what we're doing. There are plenty of nurses that I know right now that are miserable at a hospital or miserable in their clinics, and they loved these jobs before the pandemic, and then that changed so much. And the way that we we were treated, because it really was like, nurses are the heroes, and then the next week it was like those tyrants, and it's just like, okay, well, I think when it comes to healthcare in general, if you pushed, if you push the government into it and they have control, it will limit your options. And I don't want my options limited, period, because when I was having issues with my stomach, I called the doctor's office that I wanted. He doesn't live in my town. I know him from where I worked at the sheriff's department. He took care of the inmates, and he was the surgeon that I wanted because I know he took my gallbladder out before. If that changed and I had to go to another doctor and I had to go to our local hospital, I don't think I would have bothered getting the procedure. I think I would have just been miserable because when you have to go under anesthesia for any amount of time, you want the people that you trust. I'm not going to give my car to a random guy on the street to fix. Why would I give my body to whoever the government tells me I should go to? More and more, I can't deal with the thought of somebody making my medical decisions. As a female in the United States, it's weird that I feel that way, isn't it?
Well, you bring up another fascinating point, which is that one of the other reasons that healthcare costs are so high is because of collusion between the government and the medical industry. The AMA, the American Medical Association, controls the number of doctors there are in the United States. They control the number of people who are allowed to go into their residency each year. And they do that in order to keep the number of doctors low. There was a point in time when dentists didn't do that, and the market was flooded with dentists. This happened in the 70s and 80s, and dental prices dropped. Dentists couldn't pay back their loans because there just were too many dentists out there. So they responded to that by creating the ADA and stopping flooding the market with dentists. So in Massachusetts, when nurse practitioners could act as general practitioners on their own, Mass General, because it was a hospital dedicated to health, asked the group that I worked for, the MGH Institute of Health Professions, said, hey, we need more nurse practitioners. Can you guys spin up a really good program? We'll figure out the funding and we'll start cranking people through it and just flood the state with nurse practitioners. We think that will improve health generally. And so we did that. And then the doctor's like, hey, as it turns out, all those patients that we rely on are drying up because people are getting good preventative care. And so they passed a law that said now nurse practitioners can't operate in a solo practice. They have to operate under the supervision of a doctor, which is bullshit. And I mean, if you ask me, it's a little bit misogynist. I know that there are plenty of female doctors and there are plenty of male nurse practitioners. But in general, the society, it's not broken down that way.
Yeah.
I have a story for you there.
Let's hear it.
Why do I go by AJ? I go by AJ because in nursing school, we had 4 male students in the class with us, and we're all sending our resumes out to get interviews. And I noticed that every time they send a resume, they get an interview. I'm like, oh, that's surely not. Okay. I have a name that's, easily enough being initials. Guess who got so many interviews? They were so surprised when some chick showed up, just absolutely shocked. That's why, and people don't think that misogyny could possibly exist in the nursing. Yeah, it can, and I don't disagree. There are times that you want a man with that upper body strength when you have a combative patient. I can't safely take them. Like I might hurt them if I try, but this large man can be like, nope, and that be it. And I get that. But it's also, I wanted the interviews.
Yeah, but I'll come back with that. So I worked in a psychiatric hospital, and as a man working in a psychiatric hospital, I was a restraint machine. However, there were plenty of women who worked there, and their de-escalation techniques were much better than any man's. And honestly, that's a better outcome because they didn't have that toolbox of saying, oh, you know what, I'm just going to grab this guy and throw him on the ground. Oh my God, what was I going to say?
I'm sorry.
Women. No. Your point was excellent. Misogynistic. It'll come back to me. But you're 100% right it is still out there, and there's a real problem with that in understanding that the healthcare is. Okay, now I remember what I was going to say. So the one other thing that's a problem though with the single payer system is what if you are the best specialist, right? You don't get to set your prices in a single payer system.
Mm-hmm.
Yeah.
So why can't I the person who is the best, he or she should charge the most, because that's the only way to effectively divide the scarce resource that is their time. And I would like to tell you all that healthcare is the same everywhere you go. No, your healthcare professional is the biggest determination in what your outcome is going to be. And you want to make sure that you get somebody good. Now, the nice thing is that generally in the United States, the quality of care is excellent. And I say this as somebody who I hold doctors in incredibly low regard. I grew up, my dad taught at a medical school. I think most MDs will agree with me. You don't have to be smart to be a doctor. You just have to have good memorization skills. But nowadays, where all knowledge is available to you, on your phone or whatever, that's less important than ever. So you're getting people who come through, and I'm not saying there aren't smart doctors. There are lots of smart doctors who got into the business to heal people. In fact, I have a really good friend who, the reason my mom was taking Humira was because, I was able to talk to him about it, and he's an oncologist. And, at the end of it, I was really in a rough place, stuff like that. And I said, thank you so much for being available to me. He's like, Dan, this is why I got into the job. All I want to do is help people with their health issues, to give as much advice as I possibly can in a world that is, increasingly complicated. So thank you for giving me the opportunity to do the only thing that I've ever wanted to do. There are a bunch of really great healthcare professionals out there, and that's all they've ever wanted to do is to heal people. And so just make sure that, you find somebody that you're convinced that's the way they feel.
And then government gets in the way of, a lot of the problems we have is because of government's intervention to a point. We're not single payer, but what they've done so far has really exacerbated the issue. So great
Right.
discussion on healthcare. We are actually a little bit over an hour into the show. So let me take a moment. In fact,
Yeah.
you saw the video at the beginning of the show. Let me show it again. Yeah. So if I know we got people on Facebook and Twitch and Twitter. If you can't go to our YouTube channel right now, I'm at 69 subscribers. Nice, but I would like to get more. So if you have time, drop on over to the YouTube page, hit the like of the video, share it, hit the subscribe button, and there's a bell button when you subscribe that lets you know when I go live. So it gives you a reminder every week that up on the top right of the page will tell you when I go live every week and let you watch the great stuff that we're putting out here. So and the more
Guys,
people that-
if we get to 10,000, it's going to get monetized. Quality will be better. I will wear better outfits. I will shave before I come on the show. Dave will,
building optional.
Exactly. It's an easy thing for you guys to do. And just remember, I could have been your kid, right? What you give is how we live. So please just hit that subscribe button and make a big difference.
Yeah. So and the more people we get watching the show, the more it's easier for us to get quality guests and because people want to appear on shows where they get a lot of views. So go ahead and give us a subscribe so we can point that out to our potential guests and let them know. To me, monetizing is it wasn't
I'm just
what I
about
started
the
this show. Yeah, it wasn't what I started the show on, but it's also I do pay a lot of money to actually put this show out. In fact, this month,
Let's hear it.
I'm
Let's
thinking
complain about StreamYard.
yeah, I'm thinking about ending my association with StreamYard, which I'm broadcasting on right now. So what happened was in November, I got billed for the annual subscription, $490 for an annual professional subscription. At that point, I was like, well, maybe I'll find something better. So I'll go ahead and switch this to a monthly subscription so that when it starts taking out again next November, I'll then I can it's $50 a month. I know it's going to go up, but that based off the monthly rate, but at least I can at that point control how long I'm going to be there. And what did I do? I'm a line stepper. Yes, it is. Yes, I am. I'm wearing my habitual line stepper shirt. But so right after I got billed for the $490, I was like, okay, well, let me go ahead and switch this to monthly so that when it starts going out next time, then it's just going to be a monthly. What they did was start taking, they basically turned my $490 annual payment into a credit and started pulling out the monthly fee of $50, which means I didn't get an annual subscription. And I went to them and they were like, that's our business. And I'm like, okay, well, I'm going to have to start examining other platforms.
So I think the right thing to do here is to complain on Twitter, and then we'll mention it on the show. And so everybody, what's your Twitter handle? What's the show's Twitter handle, Dave?
Twitter. We are at Papa Duke, and I think I got a video for that too. I may or may not. I'm not really sure.
All right.
It's Papa Duke as well, and it's also the Political Deep. I got two Twitter.
So I think we're going to put out a Twitter complaint about the billing practice and say, hey, StreamYard, any chance you guys can help me? I've been running a show and I've had over 150,000 views, on your software in the last year. Can you help me out with this thing? And if they say no, then I think you just go full out trash them.
Yeah.
Say,
I've already looked
one
at
of the things I don't like is that you guys like have X-ray cameras on, stuff like that.
I have started looking at other platforms. I looked at vMix. vMix is very much like Slobs, and it's a lot more technical, layering and all that stuff. Which is this is easy to use because we're a lot of this stuff is built in. With Slobs and vMix, it's more of it's almost being like a technical director on a TV show. It's a very technical thing. So, but anyway, if you can get on over to YouTube and give us a like and a share and subscribe and all that fun stuff.
Yeah, because no matter what happens, it's going to be broadcast through the YouTube channel, no matter what.
Yep, absolutely. I'm
So
trying to keep as
subscribe.
many broadcast channels open, so because we're on LinkedIn. We don't have our LinkedIn viewer that chimes in every once in a while, but we're on LinkedIn. We're on Twitch. We're on Twitter. We got 2 different channels on Twitter, 2 different channels on Facebook, and the YouTube channel. We're trying to keep as many of those open as possible because I want as many people looking at this as possible.
And we have
and check us
quizzes.
out. We have quizzes. Let me carrying me and sharing. So let me
This is like
share.
bar trivia with your friends.
It is.
So in honor of that,
Except for we
this
kind of
bottle's
sucked
getting
at it last
sadly low now. But I will break out the Blantons again
There
for
we
our
go.
pub trivia. And as is the right thing to do, I'm going to drink bourbon out of a pint glass.
All right. So we get the 5 things weekly news quiz from CNN. Ran on September 1st. I know some of you probably have already looked at it. I have not. I try and keep it. And if you watched last week, we didn't look at the news quiz ahead of time because we went 5 out of 10. So,
Yep.
Hopefully better times this week. So we've seen Serena, we've seen Mickey Mantle baseball card, and the Artemis project.
So we have officially decided we're cheating.
Context clues. So,
Right.
Okay.
Starbucks reintroduced one of the most popular drinks this week, commonly known as the PSL. What does PSL stand for?
It's gotta be
Pumpkin spice
Peppermint sugar
latte.
latte, pumpkin and spice latte, pink strawberry lemonade, or peach sorbet lemonade.
pumpkin spice.
Pumpkin spice. Yes. I know fall doesn't start for a couple more weeks, but it is officially fall now.
Pumpkins are coming in.
Oh yeah, I saw decorative gourds. I went to the Pennsylvania Dutch Market up in Hagerstown this week, and they've got the decorative gourds all out. Those won't make it to Halloween. Just like those bags of candy. If you're going to Walmart and you buy like an $8.99 bag of candy right now, you're lying to yourself. That's not going to make it to Halloween. That's not going to make it to September 30th.
Also, just as a general, I mean, this is PSL, but as a PSA, candy corn is not actually corn. You cannot use them interchangeably.
It is the devil's candy.
Oh, but please do and post pictures of what happens when you do.
Yes.
That would be amazing.
Which state's capital city is facing a water crisis after one of its water treatment plants failed? Mississippi, Alaska, Florida, and Rhode Island.
Mississippi.
Yep, and we'll talk about that in a little bit. Yeah, Mississippi.
Mississippi's got so many things wrong with it.
Yeah.
One of the things people talk about is the quality of American education, and probably we'll talk about this in healthcare too. But one of the problems is that education is so bad in Mississippi that it drags the rest of the country's average down. Massachusetts, if it were its own country, would be number 6 in the world after the big city states, like Singapore and Hong Kong. But this is a fascinating thing too, because it's a case in point where you need some really smart engineers to do some stuff. And the problem is the state doesn't pay that.
No.
And we have a real problem that, like everything else the government gets involved in, if things aren't priced appropriately, then everything gets out of whack and nobody cares. The reality of it is, all right, here's a question for you guys and for the audience. Who knows who Marilyn Vos Savant is? Anybody?
Name sounds familiar. Marilyn Beausavant.
Yes. She has an article in Parade magazine, and she is the person with the highest recorded IQ. And
Ooh.
at one point in time, she's super smart. At one point in time, somebody wrote in and said, are you concerned about the high price of gasoline? And she responded, she's like, well, think how important gasoline is to your life. It's like, gasoline is, critical for so many people to get to work and all the things you need it for and stuff like that. Said, and then, if you put it in that context, is it worth what you're paying for? And this is back when it was $2 a gallon. She's like, yeah, it's totally worth it. I'm more concerned about the high price of soda, which is completely ridiculous. You don't need in your life. And yet soda's also $2 a gallon. I don't know what it is now, but 99 cents, 2 liters, $2 a gallon. So think about water. Think how important water is to your life. What should you be paying for something that is actually that important, that critical of a resource? And it is a dwindling resource. The problem is that once it gets out of whack and the market prices aren't there anymore to support what needs to be done to make water have the value that it should, nobody takes care of it the way they should anymore. The solution to water everywhere, and there's California's got water problems as well, is that water has to be paid for at what it's actually worth, which is what the market will bear. And you don't have that when the government sets the prices through utility. And so instead you have, excuse me, Flint, Michigan, right? You have droughts in California. You have Jackson, Mississippi. You have all these failures of these water plants because nobody has a financial incentive to keep things going. And government is doing, I learned this new phrase today or this week, quiet quitting. Have you guys heard that phrase yet?
Yes.
Oh.
All right.
Yes.
Apparently I was living under a rock, but government is quiet quitting. They've been doing that for forever.
The bare minimum and charging us out the wazoo for it. The thing about Mississippi, and I haven't dove way too far into it. I know that when I lived in Atlanta, there was 2 consecutive mayors that went to prison because they took federal funds that they got to revamp the water and sewer system of Atlanta and spend it on other things because it's much more politically expedient to buy votes through social welfare programs or a new rec center or things like that than to dig up the city streets and repair a crumbling like 1930s infrastructure, because one, voters are going to get pissed off because you're going downtown and you're dealing with all that construction. So they spent the money elsewhere. They kicked the can down the road, and subsequent Atlanta mayors have had to deal with a crumbling sewer infrastructure and water infrastructure in Atlanta. And the feds don't want to give more money because they've already given billions of dollars to Atlanta to do that. I don't know if that's the case here in Mississippi, but a lot of these larger cities do get federal funds to address shortcomings within their public utilities. And whether there's been talk about the state actually withholding money from the of course it's the capital. There's probably some kind of fractured relationship between a Republican governor and a Democratic mayor and those type of things. So
Probably.
yeah, it's a sad situation, but add Jackson to a number of places in the United States where it's getting hard to get water and getting incredibly hard to get water that you can use. And apparently the water that they've been getting for the last few years has not been quality water that they could use to, say, brush their teeth or cook with.
They were supposed to be boiling this whole time. Yeah.
Yeah.
This is not a new problem. It was exacerbated by the floods, is the impression that I had gotten, is it's been an issue.
Yeah.
Right. And there is a thing, if the pipes stay full and they're fully pressurized, then you don't have to worry about contamination inside of the pipes. But if they don't have, and what they're dealing with now, low pressure, and Flint had this as well. Once you get low pressure, then everything, it all goes to shit. You mentioned Atlanta. Dave, do you happen to know who the largest, I don't know if this is true or not, who's the largest beverage manufacturer in Atlanta?
It would be Coca-Cola.
It is indeed Coca-Cola. Coca-Cola has a brand of bottled water called Dasani that is bottled Atlanta tap water. And what's crazy is that people in Atlanta will pay $2.50 for a bottle of that when they could just get it out of their tap.
Yeah.
And so really the infrastructure, the things that are working well is them getting this water and selling it at this enormous profit. They actually sell the water for more than they sell water with Coke syrup in it, which is insane. And we talk about how fair is it that they're getting the same discount price on water because government is running it. If there were any fair market system, they would be paying, a percentage of what that water is actually worth them. It's worth more to Coca-Cola. So get government out of the water system and things will start working a lot better. In fact, quick story, during Hurricane Harvey, my sister lives in Houston. They got flooded out. They had no water. The first day, her husband walked to the 7-Eleven to get water because they didn't have any water and then no power or anything like that. And the guy was there and he was selling water for $10 a bottle, which, that's a lot of money. But because he was selling water for $10 a bottle, my brother-in-law was able to buy 6 bottles of water. Happy to do it. Happy to spend $60. And when he walked back the next day, there were 2 guys with pickup trucks filled with bottles of water, and they'd driven in from Little Rock and one from San Antonio, and they were selling them at $4 a bottle. And the next day, everybody had $1 bottle of water again. So market provides. Nobody's going to go thirsty in a free market.
Yeah, price signals will drive the market. And yeah, it was a disaster situation that caused the immediate $10 bottles, but at least it allowed people to have bottles instead of having somebody go in there and hoard all the bottles to begin with. So, question number 3: which popular tourist destination was designated a gun-free zone this week? The Las Vegas Strip, Zion National Park in Utah, New York City's Times Square, or San Francisco's Golden Gate Park?
I know this.
Go for it.
It's Times Square.
Was it time? I would have assumed that Times Square was already a gun-free zone.
It has to do with the new.
Oh yeah, the Supreme Court decision.
Excuse me. Yeah, and so they had to do that because of the Supreme Court decision. But whatever.
Okay. Yep. People who carry firearms in Times Square, Times Square's new gun-free zone, could be charged with a felony under the law that went into effect this week. I wonder if that gets charged or challenged.
It's so crazy because here is when you have things like this that are arbitrary little areas. For people who have never been there, Times Square is essentially 1 block, 2 blocks. It's this little area, and if you happen to be walking from point A to point B and you have to walk through Times Square, you have to walk around it if you have a legal concealed carry permit or if you're open carrying. It's crazy.
Yeah.
So if I'll quote Dr. Feldman here. Do I believe in gun control? Sure. I wish people would control their guns. Do I want criminals to not have guns? Yes, but I don't know how to stop them because they don't seem to obey the law.
Exactly. I miss Dr. Feldman. Question number 4: Mickey Mantle baseball card from 1952 was recently sold at auction for a jaw-dropping price, making it the most valuable sports collectible in the world. How much did the card sell for? 126,000, 408,000, 4.8 million, or 12.6 million?
So I saw the story when it happened. I'm going to have to guess. I'm not sure. Does the audience know this?
Yeah, if you know it, drop it in the chat.
Because
I don't. The 12.6.
That's what feels right to me too. Because I mean, the other ones, I think the Honus Wagner, which used to be the most valuable, was over $1 million. So
Yes.
Yeah. All right. So we're going to do 12.6.
People spend stupid money on sports stuff. So yeah, do that.
All right. All
Yep.
right.
Always my theory.
12.6 million. And to me, I think the Honus Wagner card. Now, it may have been a while since the Honus Wagner card has gone up for auction, but to me,
Yep.
that one still should be the top one.
well, it's interesting actually. If you ever watch Antiques Roadshow, or just people can look it up on YouTube. So if you've already subscribed to the Papa Duke YouTube channel, while you're there, after the show is over, search for Antiques Roadshow card collection, baseball cards. There is an amazing one where a person actually has cards that were before the Honus Wagner card, and they were actual pictures of the team. It was the Boston Red Sox, and except it was before they were called the Red Sox. They were called
E-Eaters?
the something stockings, or maybe red stockings or something, but whatever it was. But this woman ran a boarding house that most of the players lived in. And so
Oh,
she
wow.
had a signed collection of their cards, all signed by them in personal notes. And then she passed it down to her child and grandchild and stuff like that. Woman brought it in. She's like, I don't know much about sports. What is this worth? She said, you've probably brought in the most valuable sports collection, memorabilia collection anybody has ever seen.
Wow.
It was amazing.
That's crazy.
Of Antiques Roadshow.
Yeah.
Love it.
Question number 5. In a recent major drug bust near the Texas-Mexico border, authorities seized more than $11 million of cocaine disguised as which household product? And I think I saw this story, and I think it's laundry detergent.
You think it's what? Laundry
That makes
detergent?
no sense.
Well, if it's the powdered laundry detergent, it makes a
Yeah.
little bit more sense.
Yeah, I think that makes sense too. Like, I could see how it might be paper towels and you dissolved it into something, but laundry detergent makes the most sense to me.
Cocaine. $11 million in cocaine. It's a hell of a drug.
Yep.
Oh, it was baby wipes.
Baby wipes.
Yeah.
What?
That's so much more disturbing.
Well,
That
and so
is disturbing,
it says they were just stuffed with them. So
Yeah. I mean, could you imagine going to the store and coming home and got a break of Coke? Wow. All right. Question number 6. Due to pressure in the Biden administration, what are some major airlines now offering to passengers when their flights are canceled?
free hotels and
sleeping-
meals.
Yep, free hotels and meals. Yeah, I saw that change this week. So yeah, several major U.S. airlines updated their customer service agreements this week to offer hotels and meals when flights are canceled. American Airlines, Delta, United, JetBlue, and Southwest have all published updates to their customer service policies this week.
Okay. I don't know how to feel about this, except I know a bunch of libertarians that travel all the time, and you hear about their terrible traveling. I hope that would help somebody, really and truly.
Oh, I do too. I don't know how well that's going to work. I mean,
I don't understand how it works, but
I mean, the thing is that what it means is that the ticket prices are going to go up.
yeah,
Okay, they're
Yeah.
essentially going to insure themselves against having to pay that out. So they'll just raise the ticket prices for that insurance.
yeah,
I
because
knew there was a
mean,
way it was going to be screwed up.
yeah,
Government.
they're still dealing with all kinds of shortages of pilots and actual flight
Sure.
crews and all that stuff. So the cancellations will probably continue well through the rest of this year. I saw one airline was complaining that the Air Force is not creating enough pilots to fly
Good
their
Lord.
airplanes. Like, okay, I mean, you can actually train people to fly large planes.
Not only that, let me tell you something. If you are young and you're interested in being a pilot, the airlines have really good recruiting and training programs right now. It's a
Yeah.
path to a 6-figure income, and it's not that hard. If you like playing video games, you should consider trying to be a pilot for a major American airline.
I don't know if I want somebody playing Call of Duty while I'm flying, man.
No, but it's, It's the same thing. I want the guy who can hit that headshot while running across the rooftop, being
Fair
the
enough.
guy who, when has to pull a Sully and land his plane in the Hudson. That's
Yeah.
the guy I want.
Yeah, absolutely. All right, question number 7. Tennis star Serena Williams began what could be your final act this week by playing in which tournament? Australian, French, US, or Wimbledon?
It's the U.S. Open, and she's
Yep.
out already.
Yeah, she lost in
And
the third round.
yeah, there's an interesting. I mean, there's a lot of interesting talk about a couple things around Serena Williams. I would recommend that people read a couple of the articles that are out there, just to get a full picture of the scenario and what happened, her past there, stuff like that.
Yeah.
And then also people who have been coming down on John McEnroe, for his statement of saying she's the greatest female player of all time. And then people say, well, why do you have to say female? And he said, well, because she's not the greatest player of all time, right? She couldn't even at the best. When she and her sister were at the prime, they played a man in Australia who was ranked like 120th in the world, and he beat them 6-love, 6-love. So
wow.
it's not, yeah. Anyway.
Question number 8. What percentage of the total U.S. population is vaccinated against COVID-19? 14, 33, 68, or 98? I'm going to say
I don't
68.
know. I think 68 too.
Yeah, it's
I
nowhere
think
near 98.
68, just because so many places have required it.
I mean, I think I know more than 2% of the population personally that refuse to get vaxxed. So
yeah, I think that the thing about it is that it's, if you talk about, so you talk about a second shot or a booster, the numbers start to get really low.
yeah,
But the first round, a lot of people got in on it. Although 68% isn't particularly high.
it's not. So 2/3 of the population with an initial series. So that would be the first and second shot. So no, that doesn't count boosters, which I would say the boosters are probably
It says less than a third. So
yeah.
yeah.
Question number 9. NASA was forced to reschedule its historic Artemis 1 launch on Monday and Saturday as well, due to a series of complications. Where is the mega rocket's launch pad located? Texas, California, Louisiana, or Florida?
It's Florida.
Florida.
So,
Yeah,
it's interesting. I read a good article about this too. They're using liquid hydrogen for the fuel. And that actually had been abandoned earlier by NASA because it had too many complications. And they're like, oh, you know what? We know better. We can do it now. As it turns out, no, there's a lot of complications with liquid hydrogen.
Yeah, liquid hydrogen is very unstable. I mean, it has to be kept at like negative 440 degrees to maintain its liquidity.
No. I just have to stop and say that number doesn't exist.
That was what
440 would be below absolute zero.
Okay, well, it's got to be kept cold.
Yes,
for it to maintain its liquid level, and so they were trying to. There was a crack in the seal, and what they had tried to do was to alternate hotter and colder temperatures to try and get it to seat properly, the seal, and it wouldn't work. So they've got to pump all that liquid hydrogen out of there and try and get that seal to work, or they're gonna have to pull the whole thing off. And there's a chance that if they pull it off, it's going to be off until later this year.
I apologize. I am wrong. Absolute zero in Fahrenheit is negative 459 degrees. I just always knew it as negative 270 Celsius or 0 Kelvin. But you are correct. It is 459. I'm going to leave the show as punishment.
Let's pour one out for Dan. All right, question number 10. According to a new estimate out this week, approximately how much does it cost to raise a child to the age of 17? Why 17? I mean, are you going to kill them at 18 or
17 is, I think 50% of high school
through the age of 17 to
yeah.
their 18th birthday. All right.
Also, because of the Stevie Nicks song.
Right, there you go. Yeah, this is gonna be $1 million.
Yeah. I
No,
mean, I feel it would be.
$1 million would be 17 would be what, $60,000 a year? That doesn't seem right to me. I'm going to say 300,000, but you guys go with $1 million because you have
Goes
to.
down when they go to school, but before then, there was a time there where my paycheck was only to go for childcare.
And I agree,
Yeah.
but $60,000 a year seems too much to me. What does it say on average?
Let's see.
Mm,
Approximately how much does it cost to
estimate.
raise a child at the age of 17?
I'm
New
going to say
estimate.
300,000. But you guys should go with $1 million. James says,
Yeah, I think 300,000 is too low. 2 million. Yeah.
all right, go with $1 million.
Nope. 300,000.
Oh,
You guys
Dan
each
was
owe me
right.
a quarter.
Dan has redeemed himself.
Exactly. Now you
Yeah.
guys have to turn your cameras off.
All
8
right,
out
we
of
got
10
8
isn't
out,
bad.
8 out of 10. We got a B. Not bad this week after getting an F last week. So,
That's our
yeah,
quiet
last
quitting on
week
the
was
quiz.
embarrassing.
yeah, last week was tough. Let's see. This is a story that I kind of want to talk about because it's getting concerning. We've had dueling presidential debates presidential and former presidential appearances in Pennsylvania this week. Let me stop sharing this. There we go. First was Joe Biden in Pennsylvania talking about I can't remember what exactly they called the name of the speech, but it was a threat to democracy, calling MAGA Republicans and Donald Trump a threat to democracy. At one point this week, he also said that if MAGA Republicans wanted to do something, that they needed F-15s. Trump comes out and calls during a rally, I think last night, calls Joe Biden a threat to the state. It seems like they're starting to ratchet up the rhetoric in a way that makes it much more likely we're going to have political violence either November or if Donald Trump gets indicted, that'll probably be a trigger point as well. Either November or anytime before the 2024 elections. I think that need some people to back down a little bit.
It's all a cycle. And people don't remember, but because they think of the 60s as this romanticized era. Actually, the 60s was incredibly violent.
Oh yeah.
Political assassinations all over the place. The police beating the crap out of people at the DNC, Vietnam marches, protests, stuff like that. We may be heading towards a conflict of that sort of proportion. And you think about what came out of that and what happened. I mean, right, it was a conflict between the unrealistic 50s and people wanting more freedom in their lives. Here, it's the opposite. It's actually both parties wanting more control, but control for their agenda. And that sucks.
It sucks, and it's counterintuitive when you think about it because we're getting to a point where the plurality of Americans are not Democrats or Republicans. They're independents. They're out of party politics, and we can't. The Democrats and Republicans want to put their stamp on controlling Americans. It's not going to go well for them.
Right. I mean, it is reminder. And tell me if I'm generating echo. I just got a.
You're low. You're really low.
Yeah, you got quiet.
All right, hang on. Audio. How about now?
There we go.
That's good.
Okay. So the thing that irritates me the most is this idea that one party is better than the other, and people believe that their party is better than the other. And that's such a break from what used to be our governing principle, which is that we are Americans in this together. And now Republicans want to rule and Democrats want to rule. And that's all they want. They're like, we have to get our agenda done. The other guys are bad guys for stopping us from doing what we want to do. I don't know what the solution to that is. I do worry that it's going to end up in violence. And I hope that, I mean, honestly, here we are. I'll say it. I think that there is going to be significant political violence. And the path out of it, I would have said previously, I would hope that it would be the Libertarian Party. Fortunately, now I think the modern Libertarian Party is going to have a hand in some of that violence.
Oh, yeah.
So I don't know who's going to be the path out of it. Maybe it's the New Liberty Party. Maybe it's Smaller Government Party. If you go to smallergovernment.party in your browser, you can check out their platform. I didn't even know .party was an extension.
But I think it was made for parties, like functions, rather than actual political parties.
Oh,
Interesting. Still,
that is interesting.
Anyway, smallergovernment.party. I started checking them out.
Our friends in Keystone, our friends
in Keystone,
Pirates,
the new what is it? Libertarian Association of State. I don't know, something like that.
ALSUPs.
Oh, they need to fix that.
Yeah, it's a terrible acronym. Association of Libertarian State Parties.
Yeah.
But yeah, they should do something like that. Like, organization, State Libertarian Organization of Parties. SLOP.
That's so many words. That's like
call it something popular, like call it Taco Tuesday Party or deep fried burritos. Deep fried burrito party. Like a taco truck on every corner. That should be the motto.
Oh, that's a good one.
Something like that. But
no,
go ahead, AJ.
I do think that you're both correct. And I was talking to Charlie about this the other day. I said it feels like something has to give because both sides are just demonizing each other. We've all noticed. We've all stepped back and been like, you know what's weird is a couple of years ago you said the exact opposite. Or hey, a couple of years ago it was them that was accused of that. You're all criminals. You're all criminals, apparently. Like everybody that's in office, everybody that seems to be in control, that is big in their respective parties, they seem to have gotten there by not great means.
Yeah.
And you're not wrong. I was hopeful the Libertarian Party would be, I don't know, the logical people, the ones that kind of set everybody down and was like, okay, so here's what we're gonna do. We're gonna retract ourselves from everybody's lives. We're gonna actually allow Americans to just live their lives, and we're not gonna bother them. We're not gonna shackle them down, and we're not gonna sit here and demonize each other for votes, because the American people, honestly, I don't feel like we're ever gonna know the truth about anything, because one party or the other has a reason to block us from the truth.
Right.
So yeah, absolutely. The 60s, if it doesn't happen, I would be surprised.
Well, I mean, here's the thing. I mean, I think one of the things that happened in the 60s is we took a look at that violence. We did take a step back.
Yeah.
Like, whoa. Okay. I don't know that it's going to happen this time. I don't know that once the violence starts, once you open Pandora's box, can you get it closed again? Because both sides seem to be so entrenched in their arrogant superiority to one another and to lording over the non-affiliated folks, that they're going to take this to the illogical end, which is a civil war, just a complete breakdown of society, that type of stuff.
Well, and maybe that is, I mean, I don't want to say national divorce, but we had this idea, right, that each state is supposed to do things differently. We're supposed to be 50 engines of democracy. It really does work a lot better if we say, you know what? Washington doesn't get to tell Texas how to do their health care. Washington doesn't get to tell Mississippi how to, as crazy as it sounds, but Washington doesn't get to tell Mississippi anything except for guarantee of people's individual civil liberties. That's the only thing the federal government should be doing. And in fact, you go back, the Constitution is pretty clear. Okay, that, coins, interstate commerce, armed forces, that's about it. But most of it's about civil liberties. And if we get Washington out of all the other things, we'll get along a lot better. And if you don't like the way things are going in Tennessee or West Virginia or Maryland, you have the ability to travel freely to another state. People can vote with their feet. And people do that, right? I mean, Tesla is moving from California to Texas. Why? Because they think income tax is stupid.
Oh, and hopefully they're not doing it for the electric grid.
Right.
All right, y'all. Well, we've gone over like 10 minutes tonight. So thanks for everyone for watching and giving us love on Facebook.
Hey, James, thanks for all those comments.
Yeah, definitely. Thanks for commenting, James. Thanks to Janice McKenzie and my friend Larissa Taylor Randall for giving us some love out there. And
the Soda King, who came in after we started talking about Coca-Cola.
Oh, yeah. Absolutely. So how does someone call in? So
put a comment in this chat just like that. We are all watching it, and we'll put your question on there. We'll try to respond to it. So we want to be as responsive. And the way to really get us to is ask your question and say, I just asked my friend Sam to join the conversation.
There you go.
Tag somebody else in there.
That's right. Anyway, thanks for everyone for joining us this week. We will be back next week. I will have my first college football experience for in stadium for a while. I'm going to the WVU game on Saturday, so I'll probably have a hoarse voice on Sunday, but we'll be back for another week of the Political Deep Dive. Have a good night, everybody.
Good night, everybody.